Well, here in Germany, coronavirus cases are soaring past previous records. 52,000 new COVID-19 infections were reported on Wednesday. There's no end in sight for the country's fourth wave, and health experts are calling for tighter restrictions. Bavaria has rolled out new rules allowing only the vaccinated and recently recovered to enter bars, restaurants and cultural venues. But it's not just unvaccinated people who have to change their plans.
The day began with them decking their stalls with lights and gifts. Traders at the Munich Christmas market had high hopes for the season ahead. We're ready for the guests and happy if someone comes. But by lunchtime it was off. The mayor pulled the plug, citing the rising number of COVID-19 infections. Following last year's cancellation, the news especially hard to take in. I'm obviously completely shocked. I didn't expect that after the positive signs coming out of other cities. It's not good. It's quite a big loss for us, for sure. But what can you do? It's just a shame that we didn't find out earlier. The move comes on the back of a de facto lockdown for the unvaccinated. Here's why. The region's healthcare system is at breaking point. The majority of patients unvaccinated.
You see the numbers every morning and you think this can't be true. And we feel a little bit like the cleaning mop of the country here.
In Berlin, a leading virologist warned MPs that restricting unvaccinated people from public life might not be enough. I think you have to think about how to introduce here an additional layer of protection for those who are not vaccinated and can be infected in private areas. And from experience, that's about group size and about the freedom to meet. The crisis comes as the three parties locked in talks to form a new government entered the next stage of negotiations, though stopped short of proposing any new pandemic measures. We expect to have a draft coalition agreement next week. Thoroughness comes before speed. Progress maybe, but of little help to those staking their livelihoods on life returning to normal.
Our political correspondent Benjamin Alvarez-Gruber is in Munich and joins us now. Benjamin, Munich pulled the plug on its traditional Christmas market at the last minute. That decision cannot have been taken lightly. What does that tell us about the situation there at the moment?
Good morning, Rebecca. I think there are 2 points that we have to make here. On one side, it shows how severe the situation is in Bavaria. State Premier Markus Söder said that this is the week of truth after declaring a state of emergency in Bavaria, in Germany's second most populous state. And the state of emergency will allow also to a faster management to avoid exactly what health care workers are warning about. That is a collapse of the hospitals or of the system here in Bavaria. And on the other side, it shows also the frustration of vendors who are also still working, trying to close their stalls that they installed here yesterday. And they are really sad and disappointed, not only by the fact that it was cancelled last year as well, but last year they were told in November that the Christmas markets would not take place. And this time it was only 5 days before this Christmas market was scheduled to open. So, of course, they are really disappointed this time.
Now, Germany is, of course, rolling out the third COVID booster shot across the country. What's the uptake been like?
Yesterday there was a pretty long queue right next to the town hall where we're standing right now, with people trying to get either the first, the second or the third shot. So there were many people interested. And of course there are professionals warning that there should be also a priority list to avoid what happens sometimes with the first jab, that people who are not first in line to get the jab actually get it. German Health Minister Jens Spahn said that there are enough booster vaccines that Germany even delayed the delivery of vaccine through this COVAX program to have enough vaccines here. So now authorities also try to increase the number of people that not only get the booster jab now, but also the first and the second one, with a vaccination rate that has not reached 70% in Germany.
Well, what are people telling you about how they feel about this imminent or this happening fourth wave? It's upon us. How do they feel about it, and how do they feel about the new restrictions?
Well, of course, all of them are really tired, but they're not keen on more restrictions. A nurse told us on the other side that it's needed, that we need more restrictions as well. Bavaria now has stricter rules when it comes to visiting restaurants, when it comes to going to hotels. But what is also needed is that authorities and also the people who work in these restaurants actually check these QR passes. The people who have been fully vaccinated have to show them that they're able to go into the restaurant. So there's one side, and also what people are asking, what they've been asking for since the outbreak of the pandemic here in Germany, is to have rules on a national level. Of course, states can have their own rules, but it's a big problem here in Germany because we have a patchwork of restrictions. In some states you have these rules, in other states you have other rules. So people know that the situation is serious, that local and state authorities are trying to do everything that they can also to avoid a collapse of the health system, of the hospitals. But they're also asking for rules that apply for everyone in Germany and not depending on the state where they are in that moment.
All right, Benjamin, thank you. Benjamin Alvarez-Gruber in Munich for us. Let's get more now from Tobias Kurth. He's the director of the Institute of Public Health at the Charité hospital here in Berlin. Dr. Kurth, thanks for speaking to DW. Now, 2/3 of the German population are vaccinated, but we're seeing record new infections almost daily. Are you surprised by that?
No, unfortunately not. So there are still not enough people vaccinated that a wave, a so-called fourth wave that we're having right now, would not happen with that massive numbers. Also, we know that the immune system is not really completely protected after the second vaccination. So it will go down, and that's why we're having the booster vaccination. So that's important. And if you are vaccinated, it doesn't mean that you cannot be infected. There's a certain chance that you still get infected and you can transmit the virus to others. So unfortunately, no, I'm not surprised by these high numbers.
Now, you said that Germany's struggle with the pandemic last winter was because of the sluggish political response. What do you see as the cause of this fourth wave?
I think there are several causes, many things coming together, as I just said, but also that there is a lack in decision making. If we had reacted 4 or 6 weeks ago with the so-called 2G principle that only those vaccinated are able to go into public spaces or in restaurants, that may have been enough. Now it's unfortunately too late, so I'm afraid that there will be other measures in the next few days or weeks.
One of Germany's leading virologists says restricting unvaccinated people in public life mightn't be enough, and he says restrictions on private gatherings might be called for. Do you agree with that statement?
Unfortunately, we don't have much choices left to break the wave. So we're seeing dramatic numbers in Germany. The healthcare system is over its limits in many regions already in Germany. So we have to do something. And because people waited, or decision makers waited so long to do anything, it won't be possible to really do it without these restrictions, unfortunately.
Now, few people expected Germany to be in this situation again this winter. Vaccinations seem to be stalling at around that 67% mark. What will it take to turn the page on the virus?
Well, I think people really have to get vaccinated. We need to have the booster vaccination for those who are above 60 for sure, likely also for those above 18. So we need to keep on vaccinating, and by this I hope that the fourth wave can be stopped, at least halt at this point. And then it's a common effort. It will remain a common effort, as there are sufficient people who are still be possible to get infected as long we will see another wave coming in the future.
So vaccination certainly the way out of this pandemic. All right, Tobias Kurth from the Charité Hospital. Thank you very much for your insights.
Thank you for having me.
Singapore is also experiencing its worst COVID-19 wave since the start of the pandemic, reporting around 2,000 cases a day. That is since it abandoned its zero COVID strategy. Now Singapore needs to get more people vaccinated to reduce the strain on the healthcare system. So it's making life potentially more expensive for the unvaccinated.
In Singapore, getting a jab is not just going to save lives. Soon, it could also save people money. Until now, the government has covered the medical costs for most COVID patients. But starting December the 8th, anyone unvaccinated by choice will have to pay their own bills.
Our hospitals really much prefer not to have to bill these patients at all. But we have to send this important signal to urge everyone to get vaccinated if you are eligible.
With 85% of Singapore's population fully inoculated, health officials say it's the unvaccinated who make up a sizable majority of COVID intensive care patients. The country is experiencing its worst wave of the pandemic as it moves its strategy from zero COVID to coexisting with the virus.
We will need to have safe management measures which differentiate between the vaccinated and unvaccinated. This is in order to protect the unvaccinated and also to preserve our healthcare capacity.
Prior to the planned hospital charges, the government had already introduced restrictions for unvaccinated individuals, preventing them from dining indoors, going to shopping malls or visiting attractions. For anyone still considering whether to get a jab or not, the high cost of an infection just might make the difference.
We can speak now to Dale Fisher. He's a public health professor in Singapore, and he's joining us today from Geneva. Dale, good to have you with us. What do you make of the strategy in Singapore to make the unvaccinated pay for their hospital treatment?
Yeah, you've said it right. It's exactly that. It's another strategy. We know that the unvaccinated are more vulnerable. We know they're more transmissible. We know they make up the majority of the patients that need hospitalisation. So in Singapore, even though 94% of the eligible are actually vaccinated, that's 6% of people still is quite a sizable number. So they're the ones putting stress on the system. So Singapore's tried many things, mostly educational and also differentiated measures such as they're not allowed to go to hawker stalls and things like that. And because of these still tens of thousands of people that are putting a stress on the healthcare system, it's as of December 8th, there's going to be a charge. Singapore's got a very subsidised universal health system, so the threat, which hopefully won't be enforced, is that sick people that have chosen to be unvaccinated won't be able to take advantage of the subsidy.
Well, Dale, there is a debate right now in Germany over a vaccine mandate. I mean, is that something that would be considered in Singapore or anywhere in Asia?
Well, I'm certainly a fan of mandating it. It's right up there with seatbelts as far as I'm concerned, that these vaccines save lives and help countries return to normal. But it's a political decision, and Singapore's been very reluctant for any mandating, as indeed most of the world. So we have these, if you like, pseudo mandates by making life difficult through various carrots and stick measures.
Dale, just very quickly, there seems to be a shift away from the zero COVID strategy that we saw originally in Singapore. Is there an understanding or realization that we have to live with the virus?
Oh, yeah, that's not new. It's clear that COVID's not going anywhere. So it's about how do you move from a situation where you kept the numbers very small and the deaths virtually rare to now introducing it. Yeah.
We'll have to leave it there. Dale Fisher, a public health professor in Singapore, expert on COVID-19. Thank you so much for joining us.
And other developments in the pandemic, Pfizer has announced a deal to allow dozens of developing nations to make and sell its experimental COVID-19 treatment pill. Ireland is asking people to work again from home as it expands its booster program. COVID cases and hospitalisations are both on the rise. And New York City will allow revellers back into Times Square for New Year's Eve celebrations, but only if they have proof of vaccination.